we're at item number 8, AB 461, Mullen Coordinated Care Initiative. Good afternoon, Assembly Member.
Mr. Chair and Senators, thank you very much for the opportunity to present AB 461. AB 461 would allow the Medicare and Medi-Cal dual eligible with developmental disabilities population in San Mateo County to voluntarily enroll in the Coordinated Care Initiative, or CCI. The CCI was established as a 3-year initiative in 8 select counties to help the dually eligible population coordinate medical, behavioral health, long-term institutional, and home and community-based services through one health plan. The Health Plan of San Mateo is a local nonprofit healthcare plan that offers health coverage and a provider network to San Mateo County's underserved population. Unfortunately, the authorizing statutes of the CCI excluded dual eligible individuals with developmental disabilities from enrolling. To address this population, the Health Plan of San Mateo has implemented a special needs plan that provides similar coordinated services. However, it has become administratively costly and financially burdensome to continue operating this small program of just over 600 individuals, and Health Plan of San Mateo will likely close this program. Without this option, these 600 or so individuals will be left without a consolidated health plan to maximize their Medi-Cal and Medicare benefits. Health Plan of San Mateo and the local disability rights community work closely together and both recognize the need for an improved continuum of care through the CCI. This is a county-specific bill with no opposition. With me to discuss the item, Trent Smith, representing Health Plan of San Mateo, along with Kathy Mossberg, representing Local Health Plans of California. To answer questions you may have, I respectfully ask for an aye vote.
Thank you. Please proceed.
Mr. Chair, members, Trent Smith, representing Health Plan of San Mateo. As Assemblyman Mullen outlined here, the Health Plan of San Mateo was concerned that they had 600 individuals who, if they were to close their DSNP plan, would be left without a coordinated care system. So they are seeking this change today. Certainly with the uncertainty of the CalMedi Connect plan or program as outlined in the governor's budget, I believe they will be keeping the DSNP plan going for at least another year until there's some certainty. But certainly this bill will give them the ability at some point in the future to close that DSNP plan and to bring this population into a coordinated model of care. So we'd ask for your support.
Thank you. Anyone else?
Chair and members, Kathy Mossberg, representing the Local Health Plans of California, one of our plans being the Health Plan of San Mateo. I think it's been outlined why this was brought forward, and we urge your support. Thank you.
Thank you. Anyone else in support?
Daniel Savino, Association of Regional Center Agencies. Among our members is Golden Gate Regional Center, which coordinates services and supports for people with developmental disabilities in, among other counties, San Mateo, expressing our strong support.
Thank you.
Devin Anderson on behalf of the San Mateo County Board of Supervisors in support.
Thank you. Anyone else? Any opposition? Questions? I believe Senator Mitchell and then Senator Nguyen. Go ahead.
It's probably more a question of you, Mr. Chair. I frankly lost track. Do we have a date by which the department thinks that the CCI will roll out?
Well, I think it's in process right now that it's rolling out. We're probably talking about the CalMedi Connect. It's been rolling out. I think there's 4 counties that they're going to do that the pilot project are, and then eventually they're going to go statewide.
And so it's the statewide date I'm asking about. Do we know? Do you remember? Because it's been a moving target.
Yeah.
So it's been implemented in San Jose and San Mateo, but not Orange.
Yeah.
But I don't have the exact.
Thank you.
Senator Nguyen.
I'm not sure. Yeah, actually, my question is not so much of the author. I'm supportive of this. My question for us as members up here is this a patchwork I mean, shouldn't we do something for all the counties so that we don't have every one of us, because Orange County is going to be coming up potentially next year, and then I'm going to be standing where you are. Should we look at a coordinated plan for all the plans that are going toward CalMedi Connect so that we don't have one after another heading toward and becoming a bill in its own? So, I'm supportive of this today, there's no doubt, but there's other plans across the state that I think we, maybe just one bill, kind of similar, Mr. Chairman, like we had this morning at another committee, instead of these little, bandages all over the state, we should just do one time bill.
And I don't disagree. As a matter of fact, I raised that same question with the author, that if we're going to do this, why don't we look at it statewide? The author chose to do just this county at this time, but maybe perhaps they could answer or as well.
Sure. Senators, yes, the issue of expanding this to include all the CalMedi Connect counties was discussed and strongly considered. In fact, Senator Wynn, Orange County, they will be rolling out their CalMedi Connect plan starting July 1. And they are very interested in being included in this as well. Really what the obstacle was is, as you all know, the need for the bill is because this very specific population was excluded from the CalMedi Connect program on purpose. There are many patient advocates who are very nervous about putting this special population into a managed care setting, and that's why they were excluded. The health plan of San Mateo did a lot of work leading up to the introduction of this bill, working with their local patient advocates to get their support. And with that local support, we were able to convince the statewide patient advocates that this was an appropriate bill. We were not in that same position to convince the statewide patient advocates that the other plans were in a similar position, and there were still concerns and suspicions as to whether those other plans were in a capable position of caring for this very special population. We have instructed many of those plans, we represent most of them, to begin to do that work, to work with their local patient advocates to gain their support in the hopes that we can come back next year with a statewide bill, as you're bringing forth or discussing here, showing that there is local patient advocate support, and hopefully that'll be enough to keep the state advocates to keep from opposing the bill.
Okay, thank you. I believe Senator Pan, you had a question or comment?
Yes, I guess, in terms of the, CCI, the California Advocates for Nursing Home Reform brought, in terms of, I think what one of the things I'm struggling with is that clearly the situation you're now, you're trying to transition into a better place, but that place also is not one of great stability or certainty. And so I don't know, can you speak perhaps a little bit into what contingency plan, do you have in terms of moving forward if the CCI shuts down in terms of the state? And so we're creating a bill, or eventually hoping to be a law that gets you to one place, but that place isn't, it's a place of great uncertainty right now, partially on the statewide level.
Yeah, and I think the concerns outlined in your analysis kind of summarize what I was trying to convey here, which is there was concern from some of the statewide patient advocates making the exact points you make, right, Senator Pan. And that is, again, one reason why we decided to keep it narrow to Health Plan of San Mateo, because they do have a special needs plan that they are caring for these individuals now. They originally, before January, thought they might close that plan and transition this population as the bill outlines, but with the announcement of the governor's budget, they have determined they're going to keep their special needs plan going for now until there is absolute certainty about the future of the CalMedi Connect plan. CalOptima, again, as I mentioned, they're rolling out their CalMedi Connect plan. They have a special needs plan as well, and I believe if they haven't already, they soon will vote to keep that plan going. So everyone's going to keep their current system going to care for this very special population until there is greater certainty with what the future of the CalMedi Connect plan is.
So just to clarify, because this bill is to authorize going into CCI, but you're saying you're actually not going to do that.
Well, they would they would have the option, that population would have, so Health Plan of San Mateo has been running the Calamity Connect plan for over a year, or about a year. It's been very successful, all indications. So these individuals do have the option. They can enroll in Calamity Connect, or they can stay in the special needs plan. If for some reason the Calamity Connect plan was not going to continue, we are hopeful that the governor and the legislature will provide some timeline rather than just cutting it off cold turkey. But I believe in that particular case, Health Plan of San Mateo, keeping its other plan open, would be able to keep these people, transition them back into the special needs plan.
And I've received those assurances as well directly from the health plan.
So just to clarify, this bill is really about creating that option, but it's not an option that's going to be exercised by that fully in terms of patients who could be one or the other.
Yeah, they're going to keep the safety valve present by keeping that other plan operating for now until, again, there's some more certainty.
Okay, thank you.
Thank you. Anyone else would like to comment? And I did believe we went through the opposition. No opposition at this time. I will be supporting the bill. Like I said, I agree with Senator Nguyen that perhaps maybe at a later time look at it as a statewide issue. As you know, it's been a kind of a rocky road to get to the point to the full implementation of CalMedi Connect. And the reason why CalMedi Connect was proposed is to have a more coordinated care initiative to allow the Medi-Medis to be able to coordinate their care much better, which obviously it allows more benefits, transportation, et cetera. The duals were excluded because that was a very much more frail population. But assuming and hoping that the CalMedi Connect is successful, and then maybe in the future we can bring back to look at some kind of statewide initiative for the volunteer portion for what you're trying to do as well. So with that, who moved it? Was it Senator Wolk or? Yeah, Senator Wolk moved the bill. Would you like to close?
Respectfully ask for an aye vote, and thank you for the conversation on it.
Sure. So we have item number 8, AB 461, due pass to appropriations. Call the members.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, aye. Hall. Mitchell. Monning. Monning, aye. Nielsen. Nielsen, aye. Pan. Pan, aye. Roth. Roth, aye. Wolk. Wolk, aye.
Currently has 7. We're going to place that bill back on call, but it's enough to get out. Thank you. We're going to move to item number 9, AB 637, compost physician orders for life-sustaining treatment forms. Good afternoon, Assembly Member.
Good afternoon, Mr. Chair and members of the committee. I present to you AB 637, a bill that expands the number of and type of healthcare providers who can assist patients in establishing their end-of-life care order. Physician orders for life-sustaining treatment, or POST, is a standard form for physician orders that clearly state what level of medical intervention patients want towards the end of their life. It helps patients talk with their healthcare team and loved ones about their end-of-the-life choices. In this way, POST can help reduce patient and family suffering and make sure that patients' wishes are known and honored in this time. Right now, the forms are required to be signed by both the patient and their physician to become actionable. However, there have been reported difficulties about obtaining a physician's signature in a timely manner. What we're looking for in this bill is to fix that problem, and it would allow nurses, nurse practitioners, and physician assistants under physician supervision to sign the POST form. This would improve the health service, and patients would be able to have access to this in a timely manner. And I have witnesses here, and I respectfully ask for your aye vote.
Thank you. Please state your name and your position, those who wish to speak on behalf of the measure.
Thank you, Mr. Chairman and members. Andrew Antwi here on behalf of the California Medical Association. This bill would help facilitate the ease of administration for these post forms during what will always be a gut-wrenching time for a patient to order and arrange, the terms and conditions of their care at the end-of-life phase. And allowing nurse practitioners and physician assistants under physician supervision to be able to sign these forms, we think extends the effectiveness of the team-based approach to healthcare. And for those reasons, we ask for your support.
Thank you. Anyone else in support?
Yes. Hi, I'm Kelly Creel, and I'm representing the Coalition for Compassionate Care of California. We are a statewide coalition that represents businesses, government, and consumers who are in support of positive end-of-life care for all Californians. We are in support, we're a co-sponsor of this bill and strongly support the proposal. Currently, the post form, it's more than just a form. It's really about a conversation between the health provider and the individual about the treatment options that are available at end of life. And it helps facilitate that conversation and ensure that people's wishes are honored. Currently, we have been receiving reports of some delays in getting physicians' signatures, particularly in rural areas or even in skilled nursing facilities where timely completion of the post form is really essential. And this bill will help resolve some of those issues. For that reason, we strongly support the bill and we ask for your aye vote.
Thank you. Anyone else in support?
Jennifer Simoes with the Medical Board of California in support.
John Joseph on behalf of AARP California, 3.2 million members and strong support.
Thank you.
Mr. Chair, members, Tim Madden representing the California chapter of the American College of Emergency Physicians in support.
Thank you. Opposition? Any opposition? Questions? I believe Senator Wolk had a question.
Yes, thank you, Mr. Chair. Thank you, Assemblymember, for bringing this forward. I just have one question. One of the things that led me to bring the post form forward in AB 3000 was that the doctor's signature meant that it was actionable. That really mattered at the end of life. It didn't matter, whoever else's signature was around. I mean, obviously the patient, but the fact that the doctor's order was there and his signature was there really meant that people could act legally and felt comfortable doing that. If this change happens, will we have the same kind of actionable behavior at the end of life or not? That's my concern. So I'd like to know the answer.
Yes, Senator Wolk. Thanks for the work that you've done to lay the groundwork for the post protocol. And there's a high level of uptake in California. And as the bill is drafted, it would lead to an actionable form.
Good. Good.
If signed by the MP or PA under protocols.
Great. With that, I would be glad to move the item, Mr. Chair, and thank you once again for bringing it forward. And thanks to CMA for being willing to expand the scope.
We have a motion by Senator Wolk.
Yes.
Would you like to close, Assemblymember?
First of all, I want to thank Senator Wolk for the work that she's done in the past and for the question, and I respectfully ask for your aye vote.
Thank you. We're at item number 9, SB 637. Do pass. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, aye. Hall. Mitchell. Monning. Monning, aye. Nielsen. Pan. Pan, aye. Roth. Roth, aye. Wolk. Wolk, aye.
Currently at 6, enough to get out, but we're going to place that bill on call.
Thank you.
Thank you. We're at, we have one more item left, item number 12. Sergeants, can we call the assembly member? Okay, we're at item number 12, AB 1278, Assemblymember Gray, cigarettes and tobacco products identification requirements. Welcome, good afternoon.
Good afternoon, Chairman, members. AB 1278 would clarify that military men and women of age are able to use their military-issued ID to receive or send tobacco products to the United States Postal Service or other package delivery services if the card lacks a physical description but includes date of birth and a photo. Military IDs have been changed to only reflect the date of birth and a photo of military personnel. For many of these individuals, their military IDs are the only type of identification they have in their possession, and this measure would simply give our military men and women the same rights we provide for our regular population. This bill would only apply to those tobacco products that can legally be sent to the United States Postal Service and other delivery services as mandated by the Prevent All Cigarette Trafficking Act. There is no opposition to the bill, and I would respectfully ask for your aye vote.
Anyone like to speak in support of the measure? We have a motion by Senator Roth. Any opposition to the measure? Questions or comments from any of the members?
Well, thank you, Senator.
Okay, we have a motion by Senator Roth. Would you like to close?
I respectfully ask for your aye vote.
Item number 12, AB 1278, do pass. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, aye. Hall. Mitchell. Monning. Monning, aye. Nielsen. Nielsen, aye. Pan. Pan, aye. Roth. Roth, aye. Wolk. Wolk, aye.
Currently 7, enough to get out, but we're going to place that bill on call.
Thank you, Mr. Chair.
Okay, if we can get Senator Hall here so we can lift the call on all the remaining bills. All right, why don't we go ahead and start lifting the calls. We're going to start off with a consent item, item number 2, 3, 10, and 11. Call the absent members, please.
Hall.
Aye.
Hall, aye. Pan. Aye. Pan, aye. Roth. Roth, aye. Mitchell. Aye. Mitchell, aye. Word. 9.
Current vote count is 9. Those bills, the consent items are out. We're going to start off with item number 4, AB 145, due pass to appropriations. Call the absent members.
Hall. Hall, aye. Mitchell. Aye. Mitchell, aye. Pan.
Aye.
Pan, aye. Roth. Roth, aye.
Current vote count is 9-0. That bill is out. Item number 5, AB 159, Calderon, due pass as amended to Senate Business and Professions. Call the absent members.
Nielsen. Roth. Roth, aye.
Current vote count is 8-0. That bill is out. Item number 7, AB 258, due pass. Call the absent members.
Hall. Hall, aye. Mitchell. Nielsen.
Item number 7.
Items. Mitchell. Aye. Mitchell, aye. Nielsen. Roth. Roth, aye.
Current vote count is 8-0. That bill is out. Item number 8, AB 461, Mullen, Dupass, 2 appropriations. Call the absent members.
Hall? Hall, aye. Mitchell? Mitchell, aye.
Current vote count is 9-0. That bill is out. Item number 9, AB 637, Compost, Dupass, current vote count 6-0. Call the absent members.
Hall? Hall, aye. Mitchell? Aye. Mitchell, aye. Nielsen?
8-0.
Current vote count is 8-0. That bill is out. Item number 12, AB 1278, Dupass, current vote count 7-0. Call the absent members.
Hall? Hall, aye. Mitchell?
8-0.
That current vote count is 8-0. That bill is out. That concludes the business of the day. We are adjourned.